name is Dr. Kyle Murray. I am with Atlas Brain Spine in Upland, California, and we are a NUCCA chiropractic office, which is a specialty of Upper Cervical Chiropractic, and I'm one of the doctors there. So NUCCA is a subsect of Upper Cervical Chiropractic, and there's a bunch of different styles of Upper Cervical Chiropractic, but Upper Cervical chiropractors are just aiming at the first bone in the neck, first two there, C1, C2, Atlas axis, and restoring proper alignment there, and then restoring the proper communication from the brain to the body. And so how they go about that differs slightly. The philosophies are a little bit different. Their analysis is a little bit different, but the same goal of getting patients well. Some differences are whether the adjustment is done by hand or by machine. So if there's a tool doing the adjustment or if your hands are doing the adjustment is a big difference. The way of analyzing it, so if it's on the orthogonal plane, meaning that it's true vertical and true horizontal, and that's what your objective is, or if it's taking it off the condyle and shifting it back in the proper position between the head and the atlas itself and C1 and C2, as there's no discs there, there's just condyles. They're just these like little holding pieces there, right? The reason why that the atlas is the most vulnerable vertebra in the entire spine is because it's not locked into place with a facet. It doesn't have a disc to support it. Especially if you have a head injury, you're gonna have a neck injury, whiplash injuries, things like that. That's really the difference, I would say, between some upper cervical approaches, techniques, is the way that they're analyzing and the style that they adjust. Those would be the top two. And then from there, I mean, the same philosophy, right? Restore the upper bone of the neck, take pressure off the nervous system, alleviate what's taking place at the stressor at the brainstem level, and then let the body begin the healing process, right? You're restoring proper communication, you're allowing the body to begin to function like it's supposed to. And as a byproduct of that, then symptomatic issues start to go away. So upper cervical chiropractors do not treat specific symptoms, but they do address the structural misalignment of the head and neck. And as a byproduct of that structural misalignment, you get symptoms, right? So by addressing that, allowing the body to begin the healing process, get from that sympathetic state, the fight or flight, to the parasympathetic, which is the rest and digest. So you're going from survival mode to healing mode. In that healing mode, the body starts to restore.